scraped some skulket off the ring road. Looks touch and go.
I'll save your space, Mr. De Vries.
Morning, Zach.
Morning, Mr. Doherty. You know, since you done his prostrate, the old fella, you can pee over a 5-bar gate first time in years.
I fear I may not be doing that sort of thing for very much longer.
Don't let the bastards grind you down, Mr. Doherty.
Out the way! Yeah, after having knuckles wrapped by the teacher, hey?
There's more to this, isn't there?
You can talk to me.
The management writes to remind staff that their entitlement is no more than 2 cups of tea or coffee per day. Any member of staff exceeding his or her entitlement will be charged with theft.
What the bloody hell's going on? One of the CAS officers wants him an X-ray for C-spine, chest and pelvis.
Get him back into resus.
What?
Get him into resus. Tell hematology to cross-match 12 units. Get the radiologist to do portable films. Bleep the anaesthetist on call and bleep scissors.
Yes, Mr. De Vries.
Resus.
But he's not my patient.
When faced with a seriously injured patient, what's the first thing we should ascertain?
Whether you're on call or not. Pulse 140, good blood pressure, 110 over 60.
Estimate his blood loss, Raj.
Couple of units at most.
I'll do the gases, shall I, while you listen to Mr. De Vries? We should have his HB by now. And could we see about some ONAG as well, please? A young person can lose nearly half their blood volume and still maintain a decent blood pressure. The only giveaway is their pulse increases. Okay?
Yes, Mr. De Vries.
Glad you could join us, scissors. 10-year-old pedestrian involved in an RTA.
HB 5.2.
6 units, stat. Pass a catheter, Raj.
Right collies. Bilateral femorals. Right tib and fib. And a right parietal skull fracture.
Well, let's see if we can get a CT. Neuro-obs, James. Come on, gentlemen, let's do what we're paid for.
Regarding untrained staff covering ear, nose and throat out of hours, Dr. Turner and I are in agreement that last week's tragedy has opened up a case for further discussion.
An appalling tragedy.
It happened. Next time it might be acute laryngeal obstruction or epiglottitis or whatever, but it will happen.
We are satisfied that emergency cover is adequate for all but the most improbable of circumstances. We feel that the present arrangement should continue. But this letter of yours, Dr. Maitland, you have threatened to circumvent proper channels and express your concerns to the press.
Whistleblowing. Claire, if you were to stir trouble with the press, you must know that your career in medicine could be jeopardized. I do hope she's not about to do anything foolish.
Junior doctors work in human hours for poor pay with little respect from those above or below them. They're used to being beaten. Oh. Yes? That's only a 4-star, isn't it?
Yes. Is that a problem?
Look, this is the first conference I've hosted. I'm sure there's enough money in the health authority coffers to stump up for a venue that won't embarrass me in front of my managerial colleagues. Thank you. Some more trying business this morning, Graham. The latest initiative from our £100,000 a year image consultants.
Oh, God.
A film crew are coming to make a promotional documentary thing about the hospital to raise our image in the region. I knew I could count on you, Graham.
This is what we call the critical hour, in which prompt diagnosis and resuscitation pay off. Unfortunately, in this country, it's time most likely spent faffing about by the roadside or faffing about in casualty.
Well, there's now a fullness in the left upper quadrant.
Our lad's blown a pupil. His rests are dropping off.
Manatom.
Cam's ready.
Let's get him up there now.
We'll give him peritoneal lavage as soon as we can, but I want the CT right away.
Have you got a minute with the lad's parents?
Tell CT I'm going to bring this boy around myself. I'm Mr. De Vries, the consultant surgeon looking after your boy. We're about to take him for a brain scan.
It is serious.
Yes, I'm afraid so. He's broken both his legs and his right arm, and he may have ruptured his spine. We're most concerned about the possibility of a blood clot building up around his brain.
Do you mean there's brain damage?
As pressure increases inside the skull, brain damage can occur. We need to remove that clot as soon as possible.
Then we shouldn't keep you.
Thank you. Extradural hematoma with signs of raised intracranial pressure. I see.
And what did General have to say?
I'm taking this boy to theatre now. We should have had a neurosurgery unit here. Only the health authority claimed they couldn't afford the 100 grand.
We often have a lot of problems shooting in some hospitals. Staff not given advance notice, that sort of thing.
They've all been thoroughly briefed to suspend normal practice and behave in the nauseatingly caring fashion expected by the public. Only kidding. Now, if that lot of Jimmys can do it week in, week out, I'm sure we can manage it for one blasted day.
Okay, he's one of our top consultants.
Right.
We're very lucky to have him.
My hair all
Great. So I've told him everything. He's briefed.
Sure.
Thanks, Dad. You're not
You
actually
ready
filming
for
this bit, eh?
No, he's just
Right,
testing.
Right.
Okay, ready to go. Okay.
Okay.
Right.
Yeah. Right.
Okay, North Central, take one.
I'm just going to call in on one or two of my regular patients, as I do every day, without fail. Now, my dear, I just want you to get well. Leave all the worrying to me. And how are we today? Do we know where we are?
Hello.
Oh.
Have you hurt your little handy?
Yes.
Oh, bless him. Let me have a look at it so I can make it all better. He'll be all right. Stupid little twat. Needs a damn good slapping.
It's a long shift, but we'd keep you company.
Oh, well, I'll certainly bear that in mind, ladies. Yeah. Right, are we ready to go? Good. Okay, Raj, okay. Why don't you tell us some things about what you enjoy about the work here?
Right, I think that's enough of that, thank you. Back. There's some much more interesting down here, and we'll be sticking to our schedule. Come on, back.
Come, cut! Don't forget! Stop! Ernest, sorry to drag you away from clinic.
Think nothing of it.
Are you all right to do the head for us?
Certainly.
I'll do it myself, only,
On the day's work, Adrian. On the day's work.
More suction. More suction. How's it going at the head end, Ernest?
Everything under control, Adrian. There she goes.
That's the pressure relief.
Nearly done.
We're still swimming in it down here. This boy's going to end the day with one less spleen than he started.
Any idea what hit him, Mr. DeVee?
J-Reg BMW 318IS.
Right, me.
No. Ruining the paint job on a classy beast like that. I think we're winning. At last.
Do you mind if I go and have a butcher's at what's going on up top?
Good idea, my boy. Come and have a look-see.
No. No problem.
It's a rupture of the frontal branch of the middle meningeal. Normally, one wouldn't be exposed to this technique in a hospital like ours. Modern surgeons are becoming more and more specialized. In my day, we were trained to turn our hands to anything.
Well, that's what I'm here to learn, Mr. Doherty.
Hi, good afternoon, Adrian. Busy day?
Oh, nothing special.
How's your motor running, Mr. DeVries?
Oh my God, the Jag!
James.
Hi.
Right, I think that's all we've got time for. Thank you very much. Mr. Doherty, I was wondering, would you have time to pop into my office this afternoon?
Well, I'm already late for clinic. Can we talk on the way?
As you wish.
Good news! Mr. Smedley will explain.
I assume you've seen our advertisement. Another consultant will provide new blood for the department.
There's not enough theatre or clinic time to support a new consultant's workload.
I'm sorry, Mr. Doherty. I'm doing the best job I can.
I had imagined I was a surgeon whose experience was still of some value. Obviously, I must now conclude that I have become one of those old duffers who so amused me when I was a youngster. Seems a lifetime ago now.
I get no pleasure from this, Mr. Doherty. I am charged in a small way of shaping an efficient health service. And that means letting go of some of the old values. A consultant will soon no longer have a job for life. Doctors will be paid commensurate with their performance. Those who don't perform will be replaced. And that is no different from the terms under which the rest of the world has to work.
I shall make plans for early retirement, Mr. Tennant. I can only hope I've been of service to my patients, a guide to my juniors, and not been a burden to my colleagues.
Catch you up, guys. James. You've been acting as though I hadn't told you I was going to be here today.
I'm sorry.
You are still on for tonight, okay?
I don't know.
Look, if you don't want us to see each other anymore, just come out with it.
I just don't feel like going out tonight. Maybe I'm coming down with something.
Oh, you should know.
Yeah, I suppose I should.
Look, I'll call you sometime, okay?
Okay.
And you're adamant you can't remember a thing?
I can't even remember my own name.
Okay. All right, well, we'll get a doctor to see you shortly. You're going to like this one, complete amnesia. I'm checking the details now.
I don't believe it. It is you, isn't it? I've got all your albums.
I honestly can't remember a single thing about myself.
What about the groupies? 10 a night, they say.
Do they?
Is it true what the page 3 girl says about the size of your, It is! I knew it! Look, have your autograph? Oh, sorry, when you remember.
Okay, so your name is Desmond Frimp, you're a chartered accountant, and you live with your parents. Okay?
Hello, Stephen. Where's your mum? How's your big bag there? I used to be a bit of a rugged man myself, but they always used to say control was the thing. Stop the ball, find your man, get it. Side of the foot. Yeah. Whoop.
Do you really cut people open?
Well, sometimes it's the only way to make people better. Why? Too gory for you, eh?
No way. I think it's great. Hope I can do that when I'm older. All time, final whistle. Do you want to go and open the car for me?
Oh, Mum. Stephen, just do as I say, please.
Wait. He's mine, isn't he?
No,
I don't believe you.
just believe it and leave it at that.
Don't worry. The doctor will be with you in a minute.
Hello, I'm Dr. Raja. What happened to you?
I fell off a roof.
How does your foot feel? Dead?
He's had 75 of pethidine.
We're going to put this fracture back in place, I'm afraid. Would you like to apply counter-traction?
Doctor?
Yes?
I think you ought to know I'm HIV positive.
Is there a problem, Charge Nurse Garden? Let's do our job, shall we? How does your foot feel?
Better.
Good. Let's put it in a back slab and I'll do a form for an X-ray.
Railwaymen and French air traffic controllers strike. Junior doctors don't.
Any idea where Dr. Yates might be?
Yeah, I'll be starting his outpatients in about 15 minutes. Dr. Maitland, RMO.
You go through all the proper channels, you know. You're off. See you later. It won't make any difference unless you've got the support of your consultant.
If word gets out, no decent hospital would touch you.
I'm just having a few minutes for my lunch. I don't think that's asking too much out of 32 hours without a break. What kind of people are we that we just stand by and let it be done to us?
Bullied, beaten, scared people. You know, I've got the beginnings of a career in a profession to which I'm dedicated. I've also got a wife and a mortgage and a consultant who's already threatened to blacklist me on the old boy network if I don't toe the line. Not so long ago, it was you who advised me not to start a fight you can't win.
Yeah, well, the stakes have changed.
Your precious Dr. Maitland certainly hasn't pulled any punches, Graham. Management repeatedly warned. Intimidation of junior doctors who spoke out. 31-year-old man with wife and 7-year-old daughter dies in A&E owing to lack of trained staff.
She hasn't named him, has she?
No.
At least she had the sense not to breach confidentiality.
Graham, focus. The repercussions are going to affect more careers than hers. Impinge on more resources than we normally command and interfere with patient care in fields wider than just out-of-hours ENT.
She must know that going this far over the line means there's nothing I can do to help her. What a waste. I never thought she'd be so foolish as to throw away such a promising career.
Well, like as not, it's missed the vital organs. Should be okay.
Bit of a nasty splinter. Sorry to bleep you over such an iffy one.
No props.
Some old Doris has coughed up about a teaspoonful of blood, normal gases and chest x-ray, cubicle 3.
We'll admit her for investigation.
Are you going to see her yourself?
Can't be arsed, Raj, mate. I'll go and tell her we're going to keep her in. Dr. Maitland, RMO.
Thank you for seeing me, Dr. Yates.
Right. What can I do for you, James?
I've noticed a Kaposi's sarcoma on the roof of my mouth.
Well, let's have a look then, shall we? Have you ever had your HIV status checked?
Not for 5 years or more. It was negative.
Well, I'd like to do the test again, please.
Okay.
And we may as well do your CD4 count while we're at it. Since oral Kaposi's, it'll be an AIDS-defining diagnosis. Any risk factors?
I'm bisexual.
Right. Prick in your arm. Nice change for you. Keep still.
Off legs? No, no, no. Send them up immediately. Bye-bye.
I'm not here to wag my finger, Claire. You did what you thought was right. But you know I can't let this go.
I know. Six more admissions and we're full.
What happens then?
We're shut. Referrals go to the general.
We never shut.
Claire, I'm not sure about this chap with chest pain. No past history of ischemic heart disease. Pain only lasted 5 minutes.
Admit him.
I thought we might send him home.
Admit. Serial ECGs, serial enzymes.
Oh, she'd stop calling me Cyril.
Claire, this lady's for the CAS officer. She's only got a headache.
Chronic subdural hemorrhage is difficult to exclude in patients of her age group. I'm admitting her for neuro-obs. Phil?
We can't be fools, surely.
Julie, can you tell the CAS officer to refer all patients to the general from now on? I'll get onto Bed Bureau and ask them to redirect GP calls.
So what do we do now?
Don't know about you, but I'm going to bed.
Me and Mick are at hammer and tongs at the minute. He wants to have kids as soon as we're married. I want to give it a couple of years. Are you and Alison planning a family?
It's not a safe topic of conversation.
Oh.
We haven't, 4 months.
Oh.
You know Alison's handicapped sister lives with us now.
Yeah.
Well, she comes into our room at all times. Alison doesn't want her to, you know, catch us at it.
Oh, sorry.
450,000 patients per year, 100,000 medical emergencies, 6,000 emergency operations, 20,000 elective operations, comfort, caring, healing. Treating you as a person, not just as a patient. 24 hours a day, 365 days a year, looking after you and your loved ones.
I'm tired. Leave me alone. No one else on the planet has to work all day, all night, and all the next day. Why should I?
Claire, tell me what's wrong.
Scissors. You've got the smallest dick I've ever seen.
You go round the other side. Are you all right in there, mate?
Get a light to me. Look, pal, I'm a surgeon. Just get some fluids into me now.
We're gonna have to get him out of here.
There's no time. Just clear the glass. Get through to me. Come on.
Keep calm. Just relax.
I'm in shock. I'm close to decompensating. If I decompensate, I'll die. Brown vent flood, crystalloid, colloid, whatever. Please!
Okay, just relax. Just relax.
Shutting down!
Just relax.
Oh, give me the vent flood. Give me the bloody vent flood! Come on! Oh! Oh! I'm in.
Dr. Yates? I didn't know you wanted to start the post-date round so early.
Tennant called me in last night. I've been taking your bleeps right through. I think I want you to take some sick leave, Claire.
I don't take sick leave. I'm still a doctor, for the moment at least.
Claire, what's the matter?
I just want to be me again. I've made no errors of clinical judgment. NHS guidelines permit me to bring matters of concern to public attention.
Well, officially, no disciplinary action can be brought against you for anything relating to this case. However, despite numerous demands, you have failed to settle your account with hotel services regarding a pint of milk which you took on behalf of the doctor's mess, which exceeded the entitlement. The princely sum of 36 pence is grounds for your suspension on a charge of theft, effective immediately.
You've won.
Mr. Cullen's widow recognized the case you've brought to everyone's attention. I have the unenviable task of speaking to her shortly. The Health Authority legal advisors expect us to settle out of court for a considerable sum. I see no winners among us.
Mrs. Cullen? Mrs. Cullen? Do you remember me?
You're the doctor that told me my husband was dead. Are you the one that said the things in the paper?
Yes.
It must have been awful for you. Being a doctor and not knowing what to do.
You of all people. I'm so sorry. Oh, I'm really sorry.
Oh.
I'm so sorry.
Don't.
I'm really sorry.
Oh,